Hi, I'm Courtney, a nurse practitioner that specializes in gastroenterology, and I'm also an acid reflux sufferer myself. Each episode, I share evidence-based information about common digestive issues and therapies to help you better understand how to improve your own gut health. Before we get started, just a quick disclaimer. This information is meant for educational purposes only. Never make changes to your regimen without first consulting your healthcare provider. Today, we're talking about a simple exercise that has been proven to be effective and is very easy to incorporate into your day-to-day routine. It's called diaphragmatic breathing. I'll first share with you step by step how to do this simple exercise, then briefly discuss the evidence supporting this therapy and some limitations for those with a hiatal hernia. So let's get right to it. First, sit upright in a chair or in a slightly reclined position. This works best after meals, especially within about 30 minutes after eating. Place one hand on your chest and the other on your abdomen. Now here's the key. You want your belly to rise, not your chest. Step 1, take a slow, deep breath through your nose for about 4 seconds. Focus on expanding your abdomen outward, like you're filling a balloon in your stomach. Your chest should stay relatively still. Step 2, slowly exhale through pursed lips for about 6 to 8 seconds. Let your abdomen gently fall. That's it. Continue this slow breathing pattern for about 20 minutes daily. The studies showing the best results use this consistently for about 4 to 5 weeks. And there you have it. Now I'll briefly share with you what the evidence shows and why this works. Multiple randomized control trials have shown that diaphragmatic breathing can reduce reflux episodes, lower acid exposure in the esophagus, and even help some patients reduce their need for reflux medications over time. One study published in the American Journal of Gastroenterology found reflux episodes dropped from 2.6 episodes down to 0.36 immediately after practicing this technique. So how does this actually help reflux? Your diaphragm is part of your body's natural anti-reflux barrier. During diaphragmatic breathing, pressure around the lower esophageal sphincter, the valve between the stomach and esophagus, nearly doubled in one study. That extra pressure helped keep stomach contents where they belong. Now let's talk evidence. A 2012 randomized control trial published in the American Journal of Gastroenterology showed that after 4 weeks of breathing training, patients had significant reductions in esophageal acid exposure and improved quality of life. Patients who continued the exercises also used dramatically less PPI medication at 9-month follow-ups. Another randomized control trial from the Mayo Clinic, published in the American Journal of Gastroenterology in 2021, found diaphragmatic breathing significantly reduced reflux events and post-meal acid exposure. And a 2026 meta-analysis published in the Journal of Clinical Medicine, reviewing 10 randomized control trials, found statistically significant improvement in GERD symptom scores overall. Now, for those of you with hiatal hernias, there's an important limitation. Most of these studies excluded patients with large hiatal hernias. Why? Because with a large hiatal hernia, the anatomy is physically displaced. So breathing exercises may not be enough to overcome that mechanical issue. So while diaphragmatic breathing can be a fantastic adjunct tool for many people with reflux, especially regurgitation or belching predominant symptoms, it's not a cure-all, and it may be less effective in patients with large hiatal hernias. The good news is it's safe, cost-effective, and easy to start today. And if you try it consistently for the next 4 weeks, you may be surprised by how much a difference your breathing can make. If you found this information helpful, please help support my growing channel by clicking subscribe and the thumbs up icon right under this video. Also, please feel free to leave a comment or ask questions about this or any other GI related topics that you would like discussed. Take care of yourself and I'll see you next time.